Flu season is almost here, and early data is showing some promising news for the upcoming season. The CDC reports the flu vaccine in South America reduced flu-related hospitalizations by 52% during the 2023 Southern Hemisphere flu season. ABC medical contributor, epidemiologist Dr. John Brownstein has more on that. Dr. Brownstein, the flu vaccine is always a little tricky, right? Because you kind of have to guess which strains to target. So how encouraged are you about this year's shot? And what guidance can you give us on when to get it?
Yeah, well, Diane, it's always a bit of a cat and mouse game. We know that we're trying to predict what those strains are going to be and make sure that you have a good targeted match. What it shows now is that the data from 5 countries in South America, it does look like there's going to be a good match. Often the Southern Hemisphere is a predictor of what we might experience in the US. It's not guaranteed, but what happens there usually defines what we experience. We saw that reduction in hospitalization from getting that flu shot. So it's a really good idea to go get that between now, Halloween, the sooner the better. And it's really anyone 6 months and older should be getting that shot. It's especially important for high-risk groups, young children, people with pre-existing conditions, pregnant individuals, and older adults. So now is the time to get that important protection ahead of flu season.
And as we mentally prepare for the season of sniffles and congestion, an FDA committee is also reviewing ingredients in some over-the-counter decongestants. What's the concern there?
Yeah, well, Diane, this is a really important issue that the FDA is discussing. It's this oral formulation of the over-the-counter nasal congestant phenylephrine. So Sudafed, PE, or Vicks, Sinex. It's been historically recognized as safe and effective, but it's been under debate since 2007. There's been clinical trials that have shown that it's not effective compared to placebo. So these oral drugs may not actually be that effective. They have side effects like nervousness, headaches, and sleeplessness. And the problem is you ingest it orally, so you may just metabolize it before it even can get to the nasal passage. So important for people to see the recommendations of this FDA panel. There are the nasal formulations that are still effective. And so people should be considering those ahead of thinking about whether those over-the-counter oral decongestants are even effective at all.
And Dr. Brownstein, as we head into cold and flu season, any tips on how to tell the difference between if you're having COVID symptoms, flu symptoms, or a regular cold?
Well, Dan, I get this question a lot. Of course, you and I have spoken about this a lot. There is so much overlap, and the best way to determine is really to get that test. You can get a flu test, you can get a COVID test. The only one that's widely available at home is COVID. And the problem is that cough, fever, headache, runny nose, that can happen with any respiratory virus. Obviously, the flu gets a very high fever. With COVID, you do also get a fever, but it can go outside the lungs. But really, ultimately, the treatments are about the same. It's about rest, drinking fluids, moist air, pain relievers. And of course, if those symptoms escalate or persist, you definitely want to talk to your primary care physician.
That's always the chief tip among them, isn't it? ABC News medical contributor, Dr. John Brownstein. Always great to have you, Doctor. Thank you.
Thanks, Dan.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.